The Role and Responsibility of Community and Public Health by Roberta Price. The role and responsibility of community and public health. Those who take the lead in the healthcare setting have many responsibilities. Community and public health is in place to serve the community for the betterment of health of the people. Although the roles and responsibilities of the public health workers is challenging, it is necessary for our society to maintain healthy communities. This paper will describe the role of community health as it relates to the population. Additionally, the structure, the legal and ethical dimensions, funding, and communication in community and public health programs will be addressed. The five areas will be discussed: describing the role of community and public health in the well-being of the population, describe the public health organizational structure, examine the legal and ethical dimensions of public health and community health services, analyze funding of public health and community health services, discuss the role of communication in community and public health programs. The legal and ethical elements of community and public health services have a direct relation on how citizens are treated and how services are implemented. As stated, state and local laws mandate the reporting of specific infectious diseases to health departments, which in turn use these surveillance data to monitor trends, obtain funding, and allocate resources for controlling infectious diseases. American Journal of Public Health, June 2014. The funding of public and community health services has changed over the years and is complex. According to McGill, a series of cuts to U.S. agencies, including public health, that took place March 1st after Congress was unable to develop a plan to reduce the deficit by 1.2 trillion over 10 years. Those cuts forced public health agencies to scale back, such as the Centers for Disease Control and Prevention, which had 285 million or 5% cut from its fiscal year in 2013's budget. The role of communication in community and public health programs is stated by Elliot C. Communication and health starts from the perspective that health is a social cultural phenomenon, but its very embodiedness pushes against the notion that health is simply an object to be studied like any other object. Communication is paramount in coordinating patients' care, so it is necessary.